So good morning. Welcome to Clinical Trials Toolkit series. This one is ClinicalTrials.gov, entry guidance, helpful tips, and compliance. Today it's hosted by the West Virginia chapter of ACRP.
I am the president of the West Virginia chapter of the Association of Clinical Research Professionals. Connie Sorello is the vice president. She is also in attendance today. So if anybody is interested in joining the West Virginia chapter, really a goal is to promote research throughout the West Virginia state. And we do that by holding these events and training and networking as well.
With that, I'm going to turn it over to Tara Riddle, who's our presenter today.
Hi, everyone. Let me get my slideshow pulled up here. Can you see that, Carrie?
No.
Okay. Oh, wait.
I made you a co-host, right? Let me make sure. Yep, I can see your stuff. Yep.
Now you can see it?
Yep.
So, welcome everybody to ClinicalTrials.gov, entry guidance, helpful tips, and compliance. As Carrie introduced me, I am Tara Riddle, and I am the compliance coordinator for ClinicalTrials.gov within the COE, and I assist the Center of Excellence for WVCTSI, and I can assist with compliance and ensuring that clinical trials are registered and follow FDA and other entities' guidelines and regulations. Questions about entry of protocols or results, entry of protocol or results. And I have a BA in counseling and rehab from Marshall University. I have a master's of social work from WVU. I have about 22 years experience in healthcare areas, with several of those years being at a clinical research organization, managing operations for nationwide programs of orphan diseases. And I'm also the mom to the cutest kid ever. And there he is right there. This is a slide from my colleague on a task force that he helped found. Tony Keys is his name. He's at Johns Hopkins, and they started their compliance program back in 2015, after they had received a pre-notice letter from the FDA about their ClinicalTrials.gov compliance. And what they found when they started looking into it is they were, you can see how many were compliant versus non-compliant. And you can see here in September 15 of 2015, this is the yellow is the total problem records, and the green, of course, means it's all good and there's no problems. And you can see after they started their compliance program, how well they have done in keeping their records compliant. So the objectives of this talk is to understand what an applicable clinical trial is and timelines, or ACTs, and how to enter a protocol into ClinicalTrials.gov, tips, hints, I'll give you some tips and hints on entry, understanding outcome measure entry, and your responsibilities of entry. Also, I'll provide just a quick update on the modernization efforts for ClinicalTrials.gov. They are moving to a better platform, and I will go over non-compliance pitfalls, and if there's any, and discuss the penalties for non-compliance as well. So applicable clinical trials and timelines. ACTs is the term that is used by the FDA for the Food and Drug Administration's Amendments Act, or FDAA. People often call it FDAA. And it designates the scope of the trials that may be subject to the registration in the ClinicalTrials.gov. There's a nice checklist available on ClinicalTrials.gov to determine if your trial does meet that. And the application itself is it'll also let you know after you start entering all of your information if it does meet that criteria as well. But this is a way to do it prior to entry. And moving over towards timelines, due dates are definitely closer than they appear, and they come up faster than what you expect. Here's a timeline chart that was developed to assist people in understanding all of the different intricacies of the timelines that are involved. So your IRB, and this is for WVU. Now, if you are working with a different IRB, of course, that would be your central IRB or whatever our IRB you're using for. But for this purposes of this presentation, I will be using WVU, the WVU IRB information. It must be completed before trial registration. And then you can register on ClinicalTrials.gov. And you need to register that according to FDAA no later than 21 days after the enrollment of the first participant. However, please note that the ICMJE, so the International Committee of Medical Journals, they require registration prior to your first enrollment. So if you are wanting to publish in any IMCJE journal, then you need to make sure that your registration in ClinicalTrials.gov is completed prior to enrolling a patient in your study. You'll need to correct your registration errors within 15 days after the date of electronic notification. So once you register your record in ClinicalTrials.gov, you'll get a notification from them stating if there's any errors that need to be fixed. If you have any updates to your registration throughout the trial, then you would need to do that within 30 days. You'll need to update the record at least every 12 months. So at least once a year, you'll need to go into it, and I will show you how you can update the date to reflect the most current verification. An informed consent form is required to be uploaded no later than 60 days after the last study visit. And you need to submit your results no later than 12 months after the primary completion date. There's a few completion dates in here in the application on ClinicalTrials.gov, and we will go over those definitions more in a bit. And if there's any results, errors, you'll need to correct those within 25 days. When we were discussing just a moment ago, if there's any changes to the record that occur during the trial, these are just some examples of things that may need to be updated within those 30 calendar days after the change occurs. I'm not going to read through those. I figure you all can read through those. This is a nice chart for people to print off and keep next to their computers, or have digitally on there that you can just pull it up and see. this tells you which entity what the entity is, what their registration time frames are, what the results reporting time frames are, and if you don't meet those time frames, the penalties that could be held to you. This penalty is a little bit higher now. It's 12,400 and some, maybe 476, maybe something like that. So it does rise with inflation. And please note, it's per study per day. So it's 12,400 and some per day that you are out of compliance, that you could be penalized. Or actually the academic center could be penalized as well. So we're going to get into the nuts and bolts of entry of protocol. We're going to start with some tips and recommendations. Don't use I, we, don't use first or second person. They don't like it. You need to use the investigator or participants or study subjects or any other kind of word, but not pronouns, personal pronouns. Typos and spelling errors are not acceptable. There's a spell check within the system. After you've entered in all the information, make sure you hit the spell check. Define all acronyms and use the notes provided by the PRS system to guide you. They are actually very helpful notes. And when the PRS team does review, and if they do have notes, some errors or some things that they want you to change, they typically tell you exactly how they want you to change it. So it's fairly simple. This is the website here for the PRS system. You will have to have a user ID or username and password, and to obtain a new user account, you'll need to contact me, and you can contact me at this email address at the bottom, or my HSC email address as well. Either one will work. Please note the organization name. You have to enter it every time. It doesn't pre-populate. So it is all one word, and you need to make sure that the WV and U are capitalized. So just kind of make a mental note of that. So when you're starting to enter a new record, or when you log into the system, if this is all yours, it will list all of your studies that you have entered in ClinicalTrials.gov. If you don't have any, it'll just be this title line up here. To do a new record, you can choose the quick link, or you can, this is a drop-down menu, and you can drop down and select new record that way as well. Just a note, when the PRS team does do the review, and while you are entering the protocol, if there are any errors or system flags that are made, they are all listed over here in red. The WVU SOP states that every person using the WVU IRB will need to enter their IRB approval number here. So make sure that that is your IRB approval number. A brief title, it needs to be in like 8th grade level, 6th, 8th grade level understanding, because this title is public facing, and people who are doing a search, they might not understand, scientific terms for certain diseases. So if it is a lung disease or heart disease or something like that, just make sure that it is easily understandable to the public. The help link and the definitions link are very helpful. There are very good guides that are associated with the help button. You click on it and there's all kinds of help topics that come up. A user's guide, it's got a lot of good information in it. Definitions, I use that a lot when I want to make sure that I completely understand what PRS is how the PRS team is defining certain terms and making sure that it does fit that certain area. Excuse me, I need to take a sip. Official title, it is required by the ICMJE, and it should be consistent with your formal IRB title. Anytime you want to hit the quit button, if you can't enter anymore, you can hit the quit button and it will save your work. You can also hit continue and it will save everything as well. The secondary ID, if you want to, a lot of organizations or academic centers, they use their NIH code for their grant if they have received one, and that helps us keep track, because the NIH also has their own set of rules in addition to FDA and ICMJE and everybody else. So the record owner is the primary contact for the record, and I'm one of your administrators, PRS administrators at the institution, are the only people that can actually change the record owner. It's typically the PI is the record owner because they are responsible for the whole shebang. Access list, that is where you would add any people that would be assisting the PI, any of the study team members or support staff. And to start entry of your protocol, you click on the open button and it will open up. There's the open button. This is the protocol section that you will see before you click the open button. And you can see it has your protocol ID, brief title up here. And then these are all the different modules within the protocol section. And you'll need to complete all of these modules in order for the record to be sent to PRS, for it to be registered and to receive your NCT number. You can see here, it'll give you a green check mark, or it will tell you if there are errors still that need to be looked at and completed before you could submit. So when I was talking earlier on that timeline chart, you could see the record there was one about updating the record annually. So this is where we keep track of that. This is where the PRS team keeps track of that. This is the date that does that, the record verification date. I suggest that every time you go into the record, you update this date. It just is, it ensures that when you are looking at the record, it's updated and it keeps track of that. If you don't go into the record, if it's say a 7-year-long study and you're not going in there to do anything, then you need to make sure that somebody sets it in their calendar to once a year to go in there and just review everything, make sure nothing has changed. And then if there's no changes, then just go ahead and update that record verification date. There are changes, if you made changes to your protocol or outcomes or anything like that, you can make those changes at that time as well. Overall recruitment status, this is where you would select if you are recruiting or not recruiting, and this is public facing. So this is how the public knows if your study is a current recruiting study. The study start date, primary completion date, and study completion date, those are those three dates sometimes can get confusing with people. The study start date is the date of first enrollment. So the date you enroll your first patient. That's when you switch it to actual and you put the date of your first enrollment. Primary completion date, that is the date that you have completed collection of your primary outcome measure. And there's actually more on this on the next slide. So it's final data collection date for primary outcome measure. So any of your primary outcome measures, if it's 1 or 20, the date that you last collect information on that from your study subject is the date that you would enter in there as actual and not anticipated any longer. The study completion date is the final data collection date for a study. A lot of times these two dates could be the same, or this one might be a few months behind or something like that. But and a lot of times what I've seen is the primary completion date is actually the date of the last study visit. The completion dates are based on data collection. They are not based on your data analysis, database lock, publication, or IRB closure. And remember, the primary completion date is the date that starts the time, the timer on when your results need to be entered. They need to be entered 1 year, within 1 year of your primary completion date. Not the study completion date, but the primary completion date. This is the oversight section. And this is where you would select if it's an FDA regulated drug or device, if it has an IND or IDE. This is where you would put in your IRB information. Data monitoring committee, if it specifically states that there's a data monitoring committee in your protocol, then you can select yes. It's not a required field, so you don't have to answer it at all if you don't want to. These last two are actually being phased out by the FDA and are no longer required to be answered at all. So we suggest you just leave those two blank. And this again is for the WVU IRB information. This is the information we would like you to use. Brief summary. This is like your brief title. This is what is public facing. So you want to make sure that it's written in plain English, 8th grade level, something like that, so people can understand what it is actually about. The detailed description, it's an optional. It can be left blank. They really don't want you to duplicate information that is going to be entered in the protocol section elsewhere, such as your eligibility criteria, outcomes measures, any of that. It's basically just that maybe you could put the scientific version of your brief summary if you want to here. But just make sure that you don't copy and paste your entire protocol in that section. It's not necessary. This is your arms section where you enter the information for your arms. It's pretty self-explanatory. If you are doing, say, a drug versus a control or placebo, again, you know, your arm title would be the name of your drug, and then you would enter an arm title with placebo if you are using a placebo. Arm types, there's multiple drop-down choices for arm types. Just select the one that best fits your arm, and then a brief description. You need to make sure that you enter the dose, how it is taken, and how often it is taken as well. Here is the intervention section. So this is where you assign what the intervention is that you're going to be associating with the arm. And then here, you need to select which one, which intervention goes with which arm. So as you can see in this one, the drug intervention is associated with the drug arm, and the placebo intervention is associated with the placebo arm. I mean, you could have multiple variations of this and still need to select which one of these. So we're going to move into outcomes measures. A protocol and statistical analysis plan must be submitted with results, and they will be public for studies with a primary completion date of 1/18/2017 or later. So just keep that in mind, that your protocol will be available for others to see. You want to ensure that there's coherence among your protocol and your registration. So you want to make sure that your protocol and what you have in CT.gov matches. The PRS team may assume that all outcomes are primary or secondary unless specified in the protocol. So it's just a helpful way to remember when writing your protocol, to ensure that you do label which outcomes you want to be primary. That becomes important because of your year time frame to enter results. Protocol upload must contain a cover page with the official title, NCT number, and version date. And you must include all primary and secondary outcomes when completing the registration. You don't have to put tertiary or exploratory. Those are optional if you don't want to upload those. And again, label outcomes as primary or secondary per the protocol. More registrations get rejected for inadequate outcome measure precision or inaccurate multiple time frames than anything else. Outcomes measures, if they're not specific enough, they will get returned to you and ask for more information. They should be specific and indicate what is being measured and what is planned to be reported. Outcome measures must be measurable outcomes. So here's some examples for you. Include the metric. So this is tips for entry of your title. Include the metric. So example, safety. That's not including enough information. Safety as measured by number of subjects with at least one AE. Be clear and concise, omit verbs. To determine the maximum tolerated dose of drug A. Maximum tolerated dose of drug A. So we don't really need all of the beginning of this. It's a statement. List outcomes separately, all-cause mortality, hospitalizations, and ER visits. This should all be listed as 3 separate outcomes. So your first one would be number of deaths, second one would be number of hospitalizations, and your third one would be number of ER visits. An exception to listing separately is if a composite score of multiple measures will be used. So, for example, if you're going to use a count of individuals who experienced any of the following of all-cause mortality, hospitalizations, or ER visits. So if you're going to total that number. Outcome measure tips, time frames. Be specific. The number of minutes, weeks, months. Example, baseline week 2, during hospitalization approximately 5 days, post-intervention week 12. So this is specifically telling you the time points. And if there's multiple time points that are included, you need to use the word change. So if this is a change in, I don't know, whatever you're measuring from baseline to week 2, then you can have both of those in the time point category, but you just need to make sure that there's some sort of measuring going on between those two. If you're not measuring a change, then each time point needs to be listed as a separate outcome measure. So if it's not a change, if you want to report a number at baseline, then it's just baseline. If you want to report a number at week 2, then it's just week 2. Scale will be used in the description. If a scale will be used, include the range and meaning of the scores. So a good example is the Hamilton Depression Rating Scale. And it's used for the rating of severity of depressive symptoms. And the scores range from 0 to 50, higher scores indicating greater severity of depression. If a scale is not linear, that would be as good to note as well. So this is what the outcomes measure section looks like. So here you can see determine the effect of, and then here down here we've changed the measure title from determining something to what we are actually measuring, the change from baseline in pain. So the scores are measured here. They have the ranges. They have what is 0 means and what the higher score means. And they have the time frame that they are measuring the change. So from baseline to 12 weeks. So here's another one. The title includes the metric, right? So it's the number of participants with at least one adverse event. That's what we're measuring. And again, the time frame also includes the specific length of time. So eligibility section, this is where you will choose if it's gender specific or sex specific, if there's age limits, if there's healthy volunteers. Eligibility criteria, this is exactly how they want you to do it. You have to write inclusion criteria, colon, and then bullet list your inclusion criteria. Exclusion criteria, colon, and then bullet list. They will reject it if it looks in any other fashion than this. Another thing is what I have noticed here is they will reject it if you have the age limit in your inclusion criteria. They don't want it written down there because you already have it up here. This is where you edit or type in all of your overall contacts. So your central contact person could be your coordinator. Most of the time we'll probably put the PI in there because they are ultimately responsible. Overall study official, again, that would be your PI. And to add a study official, an additional study official, you can add it right there as well. The study official is required by the WHO and the WHO and the ICMJE. Sorry about that. And we also need to add a location for your study. And there's a button here that you can click that and add it from there. Here's that spell check button for you to do the completed spell check right before entering or selecting that your entry is complete. Again, you can see here if you're good to go or if there's still stuff you need to fix. When you are complete with your entry, there will be a button up here at the top in your actions, green action step box, the next step box, and you will click that and it will say entry complete. Then the PI, say a study coordinator entered the record or I entered the record for you and I've hit the entry complete. Then it goes to the PI. The PI has to review all of the information entered, and this button will then read approved, and he or she will need to select approved. Sorry about that. And then right after they select approved, the PI will then need to select this button again, and at this time it should read released. And then it will go to the PRS team for their review. Down here you can see if it is an ACT or not. It will tell you right there. This is the record owner and access list we've reviewed. The initial release. This is important for FDA and ICMJE. So again, this is what ICMJE will look at as to if you got the record registered, the study registered prior to your first enrollment. The PRS review, they'll notify you if there's any major issues. It will reset to in progress, and the responsible party, who is typically the PI, will need to respond and correct any issues within 15 calendar days to release it. And if there's no major issues, then the study is assigned an NCT number and published on the public side of the database of ClinicalTrials.gov. This process is supposed to take about 2 to 5 business days, but it's been taking a lot longer with COVID and other complications. Ongoing responsibilities of record owners. Records can be transferred to other user accounts as staff change. So if a PI leaves the facility, the record can go to a different PI. They must be updated every 12 months. So again, you need to make sure that you're going in there and updating that record verification date. And the records must be updated within 30 days after the completion date, the last data collection. And failure to update information on ClinicalTrials.gov can result in penalties. Again, this is where you can see if there's any problems. If the PRS team, once they've completed the review, you can see it right there. And these are some of the problem titles that you will see. You need to submit results. All applicable clinical trials are required to submit results. All NIH-funded trials that begun on or after 1/18/2017 must report results. Other grantors may require some result submission as well. So if it says it's an ACT right here, then it is, your results are expected to be entered. So now we're going to move to the modernization. It's just a quick overview. So here is the PRS system, and this is what the login page, home page of the PRS system. This is kind of the look and feel to it, and this will be the look and feel of the new. So this is the new system is actually more of a cloud-based system. So it is more mobile friendly, mobile user friendly. It can, you can easily see or do results, enter results on iPads or tablets or phones. You can look up stuff on that as well. The registration side of things is, it's only one page of it. It has been the first kind of screenshot home base page is the only thing that has been released at this time. Once you click past that first page, it will go to it'll go back to the classic site. The beta site is what they refer to for the PRS system. It's now the new version of it is referred to as the beta site, and this is the public site. And where they are entering year 4 of this update. So it's still ongoing. There's still going to be a lot of updates coming over the next few years. They haven't really nailed down a time frame as to when they'll be 100% complete. Non-compliance pitfalls. There's 2 big ones. If the PI leaves the institution or your important due dates are not met. So if a PI is leaving the institution, we need to know, because those records, we need to determine what to do with the records associated with that PI that are in ClinicalTrials.gov. And important due dates not met, that is where a lot of penalties can occur for not getting results in time and late results and things of that nature. So penalties per FDA, the final rule, you can be anything from civil or criminal judicial actions to actual prison time, civil monetary penalties up to $12,462 per study per day, and or withholding of current or future funding to the organizations that are out of compliance. So there's a lot at risk when we don't stay up to date in our information. The FDA will send, gives you kind of 2 notices. The pre-notice letter, it's 30 days to correct, and it's not public facing. So the public is not notified that you're out of compliance. The notice of non-compliance, You have 30 days to correct as well, but the public is notified, and the correction or penalty will be noted in the record. The pre-notice letters notify that beginning 30 calendar days after the date that the letter is received, they'll conduct a further review and assessment of the trial information. And if it's still not complete, you will at that time receive a notice of non-compliance, which could include your money penalties, injunction, or criminal prosecution. We started seeing notice of non-compliance letters last year, about a year ago almost, was the first one that came out. And that was to Acceleron Pharma. And you can look any of these up. They're all public knowledge. The notice of non-compliance actually went to an investigator on August 31st, 2021. And that was the first time a specific investigator had received one. And we feel that a lot of this is actually being brought to light because of the transparency advocacy that has started occurring through some of these organizations and legal filings. So somebody's paying attention, people are paying attention, which is good, keeping everybody in check. And then there's also they have a FDA trials tracker, and you can see here how the amount of money that the US government could have imposed in fines on the date that this is pulled. You can look it up. It's real-time data. So you can look it up per institution or overall, and you can see how well or poorly an institution is doing. Take-home thoughts. Understanding when and ensuring that your study is registered on ClinicalTrials.gov, making sure that you're following the time frames and the timelines. They're not only important for compliance, but also for publishing. The FDA has started enforcement, and the NIH is completing an upgrade of the system to be more user-friendly. So, you know, they're undertaking the modernization efforts. And if you have any questions, contact your friendly neighborhood clinical trials compliance coordinator. That would be me, for any assistance. And if I don't know how to answer your question, I can find the right people that can. And there's my HSC email address down there if you need it. So I just want to make a couple of quick acknowledgements. Some of the slide deck was developed by the Clinical Trials Registration and Results Reporting Task Force, a team that belongs to that task force. And they, these are the names of the centers and the people who actually did a lot of work to develop the slide deck for members to use. And I gleaned with Tony's, from Tony's slide deck, sorry, lost my words there for a second. He completed an update on the enforcement and provided that information to us as well. So I wanted to thank those two folks, and thank you to you all for joining or watching.
Well, thank you, Tara. And thank you to the Morgantown chapter of ACRP for sponsoring us today. And thanks to everyone for joining us. Everybody have a great day.